Auburn University in the nurse practitioner program, and today I'll be performing a head-to-toe assessment. So upon entering the room and assessing the patient, he's in no obvious signs of distress. His skin is normal in color for his ethnicity. His weight, height, and vitals were taken prior to entering the room, and they were all within normal limits and appropriate for age. His gait upon entering the room was appropriate. He is dressed appropriately, well-groomed, there are no odors, and then also his speech is normal. So we will go into assessing his skin. So for the skin assessment, we will just look over for a real head-to-toe on a patient. You would assess all of their skin for purposes. I'm just going to assess what is open. So he has no obvious lesions, no signs of redness or rashes. His skin is appropriate for color. He has appropriate skin turgor. And then we would also assess for any edema, and there are no signs of any edema on his skin as well. So moving from skin and nails to the head, we would start by inspecting his hair. So looking at his hair, it is coarse. He has no signs of infestations, no signs of hair loss. It is appropriate. And then we would go to assessing his head. We would palpate for any tenderness. Is there any tenderness? Okay. And then we will inspect his face. He is appropriate. His face is symmetrical. There's no sign of any droops. And then from there, we would go to checking his jaws for TMJ. So I'm just going to let you open your mouth and close it. Let's do that a couple times. There is no crepitus when he opens his jaws. Is there any pain? Okay, great. So then we will test your jaw again, and I'm just going to let you clench your jaws. All right. The muscles are appropriate when he clenches. Is there any tenderness? Okay. So then we will move on to your eyes. So we're going to begin with a visual acuity test. For the purpose of this video, we will just do with both of your eyes open. For a true visual acuity, you would cover one eye, then cover the other, and then do both eyes uncovered. So I'm going to let you read the lowest line that you were able to read.
426,739.
So that would have his vision at 20/20, so that's perfect. So we move on from the visual acuity, and we're going to just inspect your eyes. We're going to look at your eyelids. There's no signs of any lesions, no discoloration. The eyebrows are appropriate. We're going to look at the sclera, and the sclera on both eyes is white. The conjunctiva is pink. His pupils are equal, and they are 3 millimeters, which is normal. And then also look at his cornea, and those are appropriate. So then we're just going to test his pupils. So I'm just going to let you look at a point straight ahead over there on the wall. And we're just checking for equal dilation and constriction. So his pupils are equal, round, and reactive to light. And now we're going to test your accommodation. So I'm going to let you look at this point, and then I'm going to bring it closer to you and follow it with only your eyes, okay? All right, and his eyes are accommodating. And then I'm going to let you look up, down, to the middle, over, 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 down. All right, and that's perfect. Then we're going to take a look. We're going to assess your optic nerve or optic disc and check for any signs of abnormalities. So I'm going to take my glasses off for this exam. All right, so I'm just going to let you rest your head back here for me, and then just look at a point straight ahead. All right. So his optic disc is intact and visualized. Alright, and for the purpose of this exam, we would only do one side, but on a real exam, you would do both eyes. So his lens was visualized, the retina, and they are intact and appropriate. So then we will move to his ears. So we will inspect the outer portion of the ears and the earlobe here. There are no signs of any injury. It is intact. The pinna is intact. Is any tenderness there? No tenderness is noted. And we will now inspect the inside of the ear. So the ear canal is intact. There is no redness. The tympanic membrane is visualized and it is gray and pearly in color. And you would also do this for the other ear in an exam. We're also going to do what is called the whisper test. So I'm going to let you plug that ear over there and just tell me if you can hear.
1, 2.
All right, and then we'll come to the other side.
3, 4.
All right, perfect. All right, so the ear is appropriate. The tympanic membrane is intact, so we will move on to the nose. So for the nose, we will inspect the outer nares, check for symmetry. It is symmetrical. We will palpate for any deformities. There are no deformities. Also for tenderness, there are any tenderness. All right, so now we will inspect the nares. So I'm going to look up. So the inside of the nares are pink and moist. There are no signs of any drainage, and the septum is symmetric, not deviated. We're also going to check your patency here, so I'm going to let you plug one side of your nose and blow out, and then the other. And that is appropriate. And then we're also going to test your smell here. So I'm going to let you close your eyes for me, and just tell me if you can tell me what that smells.
Alcohol.
Perfect. So from here, from the mouth, or from the nose, we're going to move on to the mouth. When inspecting the mouth, you're going to start with the lips. They are pink and moist. They are not cracked. Then we will inspect the inside of the mouth. So I'm going to let you say off for me. The inside of the mouth is pink. The tongue is pink and moist. The pupil is pink and moist. Underneath the tongue is also pink and moist. There are no signs of any lesions. Can you stick your tongue out for me? The uvula is midline. The tonsils are grade 1. With his teeth, they are good dentition. There are no signs of any cavities. So then we will also check, for the purpose of this exam, we will skip it, but you would check his gag reflex in real life. So for the mouth, that is all that we will check. We'll move on to your neck. So for your neck, we will check your range of motion. So I'm just going to let you turn your neck from side to side for me. Alrighty, I'm going to let you shrug your shoulders to make sure. Alright, let's shrug one more time. Alright, so his muscles are appropriate in the neck. And then we're going to palpate your thyroid. So for this exam, I'm going to let you sit up on the side of the bed for me. Just face that way. Alright, so I'm going to just palpate your thyroid here. And I'm going to let you swallow. Alright, so his thyroid is appropriate. There are no goiters noted. Is there any tenderness?
No.
Alright, and I'll let you lay back for me. And then with this part of the exam, we will also palpate your lymph nodes. And you just let me know if there's any tenderness. Alright, is there any tenderness? Alrighty, so there are no tenderness in the lymph nodes, and there are no enlarged lymph nodes in the neck. And then I'm going to just move your beard out of the way for just a second. And then the trachea is midline with no deviation. Alright, so from this point of the exam, we're going to move down to respiratory. So for this, I'm going to just inspect your chest and inspect the rise and fall of the chest. Alright, perfect. And then I'm going to let you sit up on this side of the bed for this part. And I would inspect the skin on the back, make sure that there is no lesions or anything on his back at this point. So I'm just going to inspect the rise and the fall of his chest. And we're going to check the costal angle. And then I'm going to let you breathe in for me. Breathe out. Alright. He is symmetrical. And then we will check for his percussion here. We will palpate in a Z shape on both sides. And the sound we heard there was the resonance. And then we would do this again. I'm going to let you take a deep breath in and hold it for me. And you can let it out if you need to, and then take another breath. Alright, and then the sound with him, with the inhale, would be hyperresonance. So at this point, you would take your stethoscope, and we are going to auscultate his lungs. So let's take a deep breath. Okay, and then we will also do that with the bill of the stethoscope. Okay, so his posterior exam, his lung fields are clear. And then we're going to just test for tactile firmness. So I'm just going to let you say 99.
99. 99. 99.
Okay, there are no signs of firmness. So we're going to come around and we're going to also do this on the front side. For the exam, I'll let you come sit on the front. So on the front, you'll do the same thing. We'll inspect the rise and the fall of the chest. And we will palpate the ribs. We would also do that on the posterior side to make sure that there are no deformities and that there is no pain. Is there any pain?
No.
Okay. And then we'll also do the tactile firmness. Let you just say 99.
99. 99.
All right. And then we will check percussion on the front. And we also hear that resonant sound here. And I'll let you take a deep breath. Okay, and then that's the hyperresonant sound that you would hear. So then we will also auscultate the anterior portion of the lungs. Just take a deep breath. One more. One more. Last one. All right. So the lung fields are also clear in his anterior portion. So from this point, we will move on to the cardiac portion of the exam. So I will let you hop back in the bed there. So for the cardiac portion of the exam, we will start by checking his carotid pulses. We would check bilaterally, one at a time. So I'm going to check over here. So his pulses are a grade 3. They are strong. We would also inspect the jugular, the intra and extrajugular vein while we were checking the carotid. So after we check the carotid pulse, we will go ahead and auscultate that and make sure we hear no thrills. And then from there, we would move down and check his other pulses. So we would go with the brachial. This is also strong in a grade 2. And then his radial. You would then move on to the femoral. For this exam, we will not check the femoral. And then we will check the popliteal. It is also strong in a grade 2. And then we would check his pulse. It's a strong grade 2. And then we would check the pedal pulses. So for the next part of the exam here, we will go back with the stethoscope and I will actually auscultate his temporal artery. Okay, and it is strong in a grade 2. So then you will move on to inspection. You would inspect the color for this exam, make sure that they are appropriate colors, to make sure that they are oxygenating well, and then we would then listen to heart sounds. So we'll listen in all 5 of the major points. So his heart rhythm and rate are regular. There are no signs of a murmur. He has an appropriate S1 and S2. For this assessment, you would also attempt to locate the point of maximum impulse. This is not always locatable on someone, but this is where you would look for it. And I am able to feel it on him, and it is strong and it is appropriate. So then we will move on to his abdomen. So for the abdomen, we will pull your shirt up for this one and we will inspect. I'm going to lay you back just a little bit here. So you would inspect the abdomen, look for any signs of distension, check for any abnormalities. Look for any signs of discoloration, and there seems to be no signs of that. So then you would move on to auscultation for this exam. We're auscultating the vowel sounds. sounds, they are active. And so then we will move on to percussion. So you will percuss off over the liver. And then also over the spleen. And then we will move on to palpation for the abdomen. For the abdomen, you'll start with soft palpation or light pressure. Just let me know if there's any tenderness. Any tenderness there? Okay, and then you move down to this lower quadrant. Any tenderness? And you're also looking for any signs of a mass or any abnormalities. A rigid abdomen, and his abdomen is soft, there is no tenderness. So then you'll move on to a deeper palpation to attempt to palpate the borders of the liver and also check for any tenderness. So I'm just going to press a little harder. Is there any pain? Okay. No pain? All right. So then we will palpate and check the liver and the spleen. And then also at this point, I'll let you sit up one more time and we will try and feel your kidneys. Palpate those. And also check for any CDA tenderness. So I'm just going to place my hand here and you let me know if there's any tenderness. No? Okay, perfect. So then we will move on to your neurological exam. So we've already determined that the patient is alert and oriented ×3. We're going to test the short and long-term memory. So I'm going to tell you two things and you remember them throughout the duration of the exam. So it's going to be a red car and a blue boat.
Okay.
All right, and so for your long-term memory, can you tell me your name?
Berkeley.
Date of birth?
March 22nd, 1993.
Okay. And what year did you graduate from high school?
2011.
All right, and who's president?
Trump.
All right, perfect. So also for this exam, we will test the mental status, and he is able to answer all questions appropriately. He has no signs of any kind of abnormalities here. We will also test his reflexes in the neurological exam. We will start with the sensation actually. So we're going to test, I'll stitch it up a little bit here. We will test the sensation here. So you'll have a sharp object and a soft object. So I'm just going to touch you with those and
Okay.
you just let me know which one. I'm going to let you close your eyes.
Okay. Hard.
All right.
Soft. Hard. Soft. Hard.
Perfect. So his sensation is intact here. So then we would move on and we're going to test his strength in his legs. So I'm going to let you pick this leg up off the bed for me and just hold it. Perfect. And we're going to do this side. Perfect. He has no drift there. I'm going to let you squeeze my hand with both hands there. His strength is appropriate. His grips are equal. We have already assessed his eyes to know that his eyes are equal and reactive. So I'm also going to test your peripheral vision here. So I'm going to come to the side and you just let me know when you can see my finger.
That's it for you.
Okay.
That's it for you. That's it.
Okay. So you would test this for both eyes when doing an exam on an actual patient. So then we are also going to do the nose to finger test. So I'm going to let you touch your finger and then touch my nose. Alright. Alright, and that is appropriate. So then for the next portion, we will test your reflexes. So I will start, and we'll start here. Okay. And then we will move up. And then I will move this. And then we'll check. I'm going to turn your arm out here. And then we will test your knees here. All right, and those are appropriate, so I'll let you scoot. Or I'm gonna test your Babinski as well while we're down here. Okay, perfect, and his Babinski is negative. So then I'll let you, we're gonna do the musculoskeletal part of the exam now. So what I'm gonna do is I'm gonna let you stand up. All right, so I'm gonna get you to put your hands behind your back, put them behind your head. And then I'm gonna let you bend over and touch your toes. And then I'm gonna let you squat. All right, so that tests all of his joints and they are appropriate. And then we will turn your head from side to side. We are going to test your gait, so we will let you walk to one side and then also walk back. And now we will test your heel to toe, so you just put your heels to your toe and then we'll walk like that. Okay, perfect. And I'll let you have a seat. So for the musculoskeletal exam, you would also palpate the inguinal hernias. We will not do that. We will also test your musculoskeletal strength. So I'm going to let you try to push my arms down. All right, and then pull back. Perfect. All right, and so then we will move to things that I may have forgotten. So on the posterior portion of the respiratory assessment, I did not, on the anterior portion, I did not assess the lung sounds with the bell of the stethoscope. You would always do that. And then also, I did not assess the duct of his eye. It is patent as well. You would assess that. And then for the purpose of this video, that would be his full head to toe assessment. And then if there were any abnormalities in any of the systems, we would go further into depth on those assessments.